The first thing I just wanted to sort of unpack a little bit was this whole idea, we talk about the fear of recurrence, but what is the fear? It's unlikely to be just sort of one thing. And so I would like, if anybody's willing to share some of the things that have come up in your time about what are the things that are fearful to you regarding, either the cancer treatment itself, or the reoccurrence. When we start thinking about combating the fear with any sort of life-changing event, and certainly diagnosis of bladder cancer is one of those events. It's a complete loss of control over everything that you normally know. You suddenly have multiple doctor's appointments. You might be hospitalized for prolonged periods of time. There are chemotherapy treatments that may or may not result in side effects that are unwanted, not a normal part of your life. And so much of that changes. You're talking about how your mom was driving you to your doctor's appointments because you either weren't feeling up to it or just weren't in a position to be driving. And that, that sort of lifestyle change, that abrupt giving up of the things that you normally have control of creates a lot of worry and anxiety and fear. And so two of the things that I wanted to highlight here is the concept and the idea of maintaining control and then regaining control. And although the topic today is about the fear of reoccurrence, I don't feel like I can just cascade over or omit entirely the whole idea of the maintaining the control while you're going through treatment, because ultimately, treatment for some may never end. It may go on for years and years. Some of you may be at the post-treatment period now, where you're in the surveillance and the monitoring. Treatment may be a reality of your life again in the future, or some of you may just be in the midst of a new diagnosis and going through treatment currently. So when we talk about the diagnosis and the going through treatment, I just wanted to bring up this concept of learning and choosing to live with your cancer, not let cancer be the all-consuming aspect of your life, but continuing on to maintain a good quality of life despite your cancer. There's I wish I could remember the language now. So, actually, Patrizia, you were there. We were talking about you may have a disability in your life, but not the impairment. And I can't remember the exact language now. Okay. Well, anyway, I won't burden you with that. But this idea of maintaining normal routines, that life itself that surrounds you doesn't stop because you've been diagnosed with cancer. Every component of your life, bills still come in when they come in. If you're a parent, your child still needs parenting and rules and discipline. There's still lots of responsibilities that everybody has in their life, and lots of aspects that can be maintained as good quality of life aspects, even though you're going through treatment. And so, I think that if this is a priority and a focus during your treatment, then the amount of anxiety and worry and fear about the reoccurrence after treatment is done will be much, much less, because there's already this optimization of living your life. And so getting caught up in the amount of anxiety and worry that might interfere with your quality of life seems to be much, much less. Okay. So at the end of treatment, there can be some mixed feelings about that. And on some respects, some relief, for sure. No more doctor's appointments to go to, maybe no more medications to take. You don't have to go stay in the hospital anymore. You've healed up from your however many surgeries that you've had. You feel good, energy's coming back. It can be very wonderful time in a person's life. On the other hand, worry and fear and anxiety about whether or not the cancer is going to come back or whether or not you've made the right decision, that can linger for a much longer period of time. And there can be ebbs and flows to this, as we'll get into in just a minute. And then for some, a question of whether or not treatment really ever ends. You were talking about somebody who's on her 5th round of... 50th. I'm sorry, her 50th. Yes, so treatment for her is it's a persistent process in order to sustain and maintain it where she's at. And so that's an adaptation that needs to occur. Okay, so coping with the fear. So one of the topics that's frequently brought up is developing a good partnership with your doctor. And the partnership word, I think, is the most important word here, because it talks about you and your doctor can be partners in your health care. That, you know, there's oftentimes almost a subordinate relationship where, you know, sometimes the doctors are telling you what to do, and certainly from a medical perspective, taking their advice, having them make the treatment plan, and going to them for questions and answers. But really partnering with them and advocating for yourself about what's the best plan of care for your life, for your quality of life and your lifestyle. And then talking with them and having them outline the immediate and the long-term side effects that might occur with either the diagnosis or the treatment, you know, whether it be surgery versus the chemotherapy. And then also communicating with them after treatment is done, then this whole concept of a survivorship care plan. Has anybody in the room heard of that before? Do you have a survivorship care plan? Sort of, yeah. But you've heard the term? Okay. This is certainly a concept that every cancer doctor should have heard of. Claire, have you? Yeah, you know this. Okay. When treatment is done, the idea, having a written and documented survivorship care plan, which includes a wide variety of information, from your medical history to what your follow-up treatment plan should be, how frequently you should be getting scans done, and I think depending on the physician and what the two of you decide, that would be contoured or customized to whatever your plan, what your needs are, based on your diagnosis and where you are in your stage of care and that sort of thing. There are lots of resources available online with these, but these are certainly things that when you speak with your doctor and you talk about your survivorship care plan, they should be able to go through and talk about the specifics. It's not this enormous, elaborate, secretive thing that we want to keep from you. We want to make sure that you're heavily involved with it. And then, so it includes your regular follow-up care, your customized plan, and then your treatment summary as well. And this, having this in writing and something that you can refer to will allow for recognition of what comes next in the steps. You might have a period where you don't have any doctor's appointments for 3 months, and then in 3 months you can come back and see your doctor, so that in that time you can make a life plan around that. Okay? And then remaining well informed. So discussing, based on your current circumstances, what are your recurrence risks with your oncologist? And, I think they'll be very, very forthcoming with you, depending on the staging, and allows you to start establishing good expectations of what to expect in the coming months. And then, as well as in the specific symptoms to look for. As we know, not every ache and pain is going to result, although blood in the urine is never a good thing, right? Yeah, okay. Okay. Yeah. But, every ache and pain doesn't necessarily equate to cancer. So having your doctor talk with you about very specific things to be looking for, so that you're not going to the emergency room every single time, or feeling, increased anxiety because you're so concerned that the cancer is back. And then obviously getting your information from reliable resources. And I have some websites at the bottom of this, although you've got some pamphlets here. Any questions, though, Wikipedia is not the place to be getting them. If you have medical questions, please discuss them with your doctor, okay? All right. And just sort of a general statement that information and understanding the information that's given to you allows you to be the best advocate for yourself. Healthy living is another aspect that's often talked about, and I'm sure every single person in this room has had a conversation with their physician at some point about diet and exercise, getting good sleep, not smoking and bladder cancer, right? Isn't that the number one sort of, no smoking and no heavy alcohol use? And then reducing stress. And, stress reduction for each person comes through a variety of resources, and what works for one person might not be terribly effective for another, and vice versa. Certainly, spending quality time with your friends and family, not the stressful times with your friends and family, so that you are enjoying life, having hobbies, stress relieving activities, from if it's walks to playing cards with friends or whatever it happens to be. Avoiding any unnecessary stress, and this includes drama that might happen in your social network, either with friends or family, and then overcommitment to activities. So trying to minimize the amount of stress that you have in your life, and joining a support group. So let's talk about the fear, worry, and the anxiety. With learning to, I almost have a visceral response to the whole idea about accepting, accepting anxiety, worry, and fear. It is, it is what it is, and there is going to be a certain amount of acceptance of the worry and fear that any person has in their life. And so getting to a stage where you can recognize that the emotions that you go through with the anxiety and fear are completely normal. There's going to be lots of ups and downs through everything, and not just through the treatment itself, but then post-treatment with the fear of whether it's going to reoccur. These emotions can have ebbs and flows every time you have your diagnosis anniversary date, every time you go for a scan, every time you go to the doctor's office. What we do know is that over time, the anxiety and the fear response to those activities, to those situations related to your cancer, and really just about anything, dissipates over time, as long as it's if it's a normal adjustment reaction. If it gets into something more severe, we'll talk about that in a minute. But from a normal perspective, you're going to have ups and downs, and so accepting that, letting yourself be okay with the fact that you're going to feel terrible some days, you're going to feel very, very worried some days, but then there'll be other days that'll be better, and to not berate yourself for either feeling weak because you're worried or fearful, but that it is it's a part of the healing process. And then learning to manage. So there's the acceptance piece, and then, all right, I accept it, I'm anxious, what do I do with it now, right? Is being able to identify the aspects of your anxiety and fear, the things that you're most fearful about. And that's what we did in the beginning, was trying to identify some of the things that create fear. And for some of the people in the group here, it's about whether or not you would be able to keep your bladder, right? For other people, I've written a few things here regarding the loss of control over your life, having to go through treatment again, maybe having to go through more surgery. That would be a fear. There's always the fear of more pain, some form of disability, and even death. And once those fears have been identified, then you can do something about it. Then you can have ownership over that and talk with other people to get some help on how to deal with those fears. So not doing it alone. Joining a support group is always a good first way to go. Talking with your friends and family members about it, and honestly even talking with your physicians about what your greatest fears are, and helping, and in that way they would be able to, when it comes to your survivorship care plan, be able to address that issue. If your primary fear is fear of losing your bladder, they can talk specifically in your situation about what the likelihood of something like that happening would be. Okay? And in general, live your life, which brings us back to the first concept about living with cancer. Continue to live your life. Life doesn't need to be put on hold. You may, like you pointed out, there are some limitations. There's new things that happen that you're not able to engage in anymore, and that's a loss, and certainly not anything that you want to see happen. But there are lots of other aspects for good quality of life, and perhaps there are new things to be engaged and involved in that bring about even better quality of life. When normal adjustment to, I'm a psychologist, so I always have to go this direction as well. So when normal adjustment, the normal ups and downs, when more help is needed, when those symptoms persist for a much longer period of time and they interfere with your ability to, enjoy normal activities, care for your own needs at home, if you're not getting to your doctor's appointments, or even somebody you know, a relative, a friend, something like that. When you see that this is happening and they're not taking care of themselves, and their anxiety or their depression or whatever it happens to be is interfering with their ability to just have a relatively normal life, then more help is needed. And obviously, if there's ever the prolonged sense of hopelessness, and then any thoughts about ending life or suicide, is a time to get somebody else involved. Okay? From a mental health perspective, always talk to your physician. If you're in the clinic, one of the social workers, nurse practitioners, anybody. We're here to help and always want to. Okay?